it's held steady at a 200% increase. And I think it's important that we recognize that we're talking about people who have been connected to NAMI NYC for a long time, to sort of our participants. We're concerned about getting the disease, the virus, of course, but also worried about getting treatment, accessing food, accessing medication, wondering if the pandemic would increase their symptoms. We've also seen people who have never dealt with mental health issues prior calling us and saying, I'm not sleeping, I'm feeling sad all the time, I feel lethargic, I don't have a lot of energy, I'm not really interested in hanging out with my friends on Zoom. What's going on? Is this normal? Am I okay? And so we're seeing a swath of people who had never before theoretically dealt with these kinds of issues and these kinds of challenges, who are now starting to experience some of the changes. And I think it makes sense if you think about what we're living through and what we're going through. So right now we're in the midst of information overload and a really politicized environment. All of the social justice and racial justice issues that have resurfaced since the summer. Now there's another wave coming that I look at that map every day and it just becomes redder and redder. That's scary. It's anxiety provoking. And I think when it reiterates the fact that we'll likely be living like this for some time, I think if it furthers that loss of control, that sense that so much is out of our control right now. And it also has really disrupted our ability to have any kind of routine. And I think control and routine, that's sort of the life that we're used to. We have some control over what's going on and how we're spending our time. We're able to have routines that give us a cadence to our day. And all of that has sort of been taken away. And I think to some extent, it feels a little like possibilities have been taken away during all of this. And when we're living without possibilities and an idea of when things may return to some sense of normalcy, it makes sense that we're a little bit dysregulated, that our mood is changing, our behaviors are changing, our anxiety levels may be changing. And I think, of course, there are clinical needs that individuals who are experiencing mental health challenges may need. But I want to make a distinction between someone living with mental illness and people dealing with the challenges to their mental health. We want to think about mental health as a spectrum, as a continuum, and different things that are going on are going to tell us where we may fall along that continuum at any day or time. And just because it's not about meeting the diagnostic criteria of the DSM-5. This is about how is what I'm living through affecting me? How is it getting in the way of my ability to function in the ways that I have historically functioned? And what can I do to both understand the ways in which it's affecting me and also manage through that, especially as we're seeing now that it looks like we'll be living like this for quite some time. So I want to talk a little bit about the fact that there may be clinical needs. People may need therapy, they may need treatment plans, they may need medications, they may need all different resources. But we also really need community and connection. So even if your mental health symptoms or your diagnosis don't meet the threshold of more clinical treatment, we're all still in need of connections. We're social beings. And this social isolation has really affected our ability to spend time with people that we care about. Again, the routine that I mentioned before being so disruptive and us having very little control or feeling as if we have no control over everything that's happening. So what can we do about that? I think one of the things that we can do is to focus on the things around which we do have some control. So for me, I have found since the beginning, limiting my intake of the news has actually been really helpful. When the pandemic first hit, I, like so many others, were sort of glued to the television, have it on in the background all of the time. I found that wasn't helpful for my mental health. And even when the election results were coming in, I would watch for a little bit. And when they started to repeat themselves and I wasn't getting new information, I said, I'm going to turn this off for a little bit and I'll come back to it then. Those are some of the things we have control over. But I think it's important, and I want to spend some time on this next piece, which is looking at this experience that is a shared experience through the lens of trauma. I think it's critical that we recognize that we are living through a collective traumatic event. And there is no right or wrong way to react or respond to trauma. There's no one size fits all to reacting to trauma. And actually, one of the things that makes it really complicated is that it's difficult to process the trauma while you're still in the midst of it. So the longer term effects of what we're all living through right now have yet to be seen. How we interact with new people when we meet them. Do we shake their hands? Are we comfortable in elevators and small groups, even years out from this experience? What will social life be like? The longer term effects of this, living through this trauma, we really don't know. And I think the best example that I can sort of give you, it's a real base example to kind of conceptualize the idea that we all experience trauma in different ways, would be to give you an example of a house fire. So let's say Drew and I are hanging out in my house, and my house all of a sudden catches on fire. And Drew and I, we run out, we get out, and we're fine. We're each physically fine. We didn't get hurt at all in the fire physically. But so we lived through that same experience together. We were each in the same house that caught on fire. But our reactions and our responses and the impact that living through that situation together might have on each of us could be markedly different. So Drew might get out of the house fire and say, wow, I can handle anything that comes my way. I can react really quickly. I can take care of what I need to take care of. I can, in the face of that kind of scary experience, I can still have my wits about me and make sure that I'm all right. And I might come out of that experience and feel like, wow, the world can change on a dime. You can't trust anything. You can't rely on anything. This world is a terrifying and scary place. And so even though we went through the same experience, how we are left feeling about that experience after the fact will have a long-term impact on our coping mechanisms and the way we sort of sit in and experience the world. And I think it's really important that we think about that as we think about how and who we're interacting with. So we want to recognize that even though I may be feeling all right, living through this trauma, people around me may be reacting in different ways. And I want to give everyone permission to experience the way that you are feeling right now and not worry too much about comparing that experience to what other people are going through. I think, we want to think about the fact that we have all experienced some level of grief and loss as a result of what's going on around us. Certainly the loss of life due to the disease, the virus, I think is at the highest end of the most profound losses, and the inability for people to come together and grieve in the ways in which historically bring people comfort during a loss like that. But there are lots of other losses that may not meet that same level of profoundness, but that are really important. So, seniors in high school lost prom and they lost graduation. People lost weddings. We've all lost the ability to connect and be in the same room together, to spend time with people we love. For some people who have been alone this entire time, they've lost physical contact with human beings, which is huge. It's enormous. The loss of the routine that I mentioned before is really also quite significant. And I think just the loss of the world that we knew before March. This is no small feat. But I think we're the first generation to have feelings about our feelings. So I may have a day where I wake up and, quite frankly, I have embraced the fact that I don't know what this day is going to be like until my feet hit the floor every morning. And I'm allowing myself to try and take each day as it comes and know that some days I'll feel really productive and I'll feel good and be in a good place. And other days I might be struggling a little bit more. But on the days when I'm struggling, what I've noticed that we do, just sort of all of us, is, I'm not feeling so hot today. I'm feeling a little down. And then I'm sad. And then I think, but there are people who have it so much worse than me. And I'm safe, I'm healthy from the virus. My family and friends are safe and healthy from the virus. I have the food that I need. I have space. I'm okay. I shouldn't feel so sad about it. I've got it better than other people do. That's a problem. We need to stop at the first feeling. We need to allow ourselves to experience that feeling if we want to sort of figure out how to navigate through it. And I think we want to pay attention to the fact that even though our grief and our loss may be different than other people's, that it doesn't diminish the impact that it's having on us, on me, on my well-being. And I think when we think about it through the lens of trauma, through the lens of grief and loss, hopefully it brings about a sense of compassion. And I think that compassion is for other people, recognizing, right, that there's no right or wrong way to get through a traumatic event. Other people's ability to cope right now, we need to be compassionate about that. And we also, just as importantly, we need to be compassionate to ourselves. That self-compassion is critically important. I've also heard a lot of people talking about how we're all in the same boat, that we're all living through this together. I want to qualify that a little bit. I think that we are all in the same body of water, but our boats look really different. So some people might be in a yacht, some people might be on a raft, you might be in a kayak all by yourself, or maybe you're in a rowboat with a group of people. But what your boat is like, even though we're all in the same water, is going to have an impact on your experience too. So whatever boat you're on, you got to look around and see the other boats and experience what it might be like for other people who are going through this. And I think that is an important way to remember that just because I'm okay today doesn't mean my colleagues or my partner, my spouse, my friends, my kids, my parents are going to be doing okay today. And I think that having that empathy and recognition, and actually I think if there are some silver linings to all of this, I think one of them is that hopefully we're seeing an increase in empathy and an understanding of what it's like to live through an event like this that has an impact on your mental health. I think all those individuals I mentioned before who never were dealing with these issues, who now have a real understanding of what it's like to experience a depressed mood, might no longer feel appropriate. It might not be appropriate for them to say, oh, you're not trying hard enough. Just try harder and you'll be able to get out of bed. And I think that sort of blame and the shame that we associate with mental health conditions when we don't understand them, we may be seeing that lack of understanding dissipate some, because I think there's more recognition of what it's like to experience these kind of symptoms, these kinds of moods. And I also think that one of the things that gets in our way of helping each other is stigma, certainly. And what we want to make sure that we're mindful of is the importance of, if we are struggling, if I am struggling, I need to find someone that I trust to talk to about it. I can't bear the burden alone, especially like this during these unprecedented times. And I think that just as important, because it isn't all on the individual to take the steps to get the help that they need, just as important, we want to make sure that if we see someone who we think may be struggling, if we're seeing changes in behavior, changes in physical functioning, changes in mood, if someone's acting differently, behaving differently than they typically do, we need to say something. We need to take the step to ask if the person's okay, to let them know that we're worried about them or concerned about them. And I think one of the things that gets in the way of our doing that is a fear of what the person's going to say. When I say, hey, I'm a little worried about you. How are you doing? Are you okay? I don't know what they're going to say back to me when I ask that question. And that's a little unnerving. So often we just don't ask the question at all. We think, well, somebody else will check in. It's not my place. I'm not a therapist. I don't know how to help them. I think sometimes when we ask the question, it feels as if we then have to fix it. We have to solve whatever's going on with that person. And I want to take that pressure, the weight of that off of you. It is none of us are responsible for solving the issue or addressing the problem, but we can be a source of support and a source of comfort and validation to let the person know that you care about them, and be a bridge and a connector to the resources that they need and the help that they deserve in order to get the kind of support that they need and to cope, to get through this. So when we reach out, it's not about solving it. It's not about fixing any problems. It's not about taking that responsibility on. It's about seeing someone in pain, seeing someone struggling, and being a bridge to get them the help that they need. And I think for ourselves, it's just as important that we find that same level of comfort. If we're going to take the step to reach out to someone, we also need, if we are struggling, to find a trusted individual. And it might be a friend, it might be a family member or a colleague. It might also be you reach out to NAMI NYC and you call our helpline, you just talk to someone about what you're going through. I think we have to get to the point where we recognize that it really is okay not to be okay. And if there's ever been a time in our history where we could really relate to that sentiment, it's right now. It's 8 months in, knowing that the next 8 months are going to be just as difficult. I think we need to pay attention to how we're feeling, pay attention to our bodies. We often recognize things in our bodies before we recognize them in our minds. And so you want to pay attention to how you're feeling physically inside your body. And if you're feeling differently than you have felt before, you want to pay attention to that and speak with somebody about it. And I think, also we want to think about self-care and resilience. And I'll start with resilience. Resilience is really recognizing when you've been through something difficult before, what helped you get through it? What helped you bounce back? What were the lessons you learned? What were the tools that you developed and honed that you were able to rely on to help you bounce back from that difficult situation? It may not have been a situation like a pandemic, but those same tools, those same skills that you were able to utilize when you went through a different kind of difficult experience can be particularly helpful as all of us are struggling in some way, shape, or form right now. On the self-care piece, I think self-care has become a little bit prescribed in some ways. And I think in my experience, people use it to describe going for a run or meditating or doing yoga. And none of those three things is something I'm interested in. So if that's what self-care means, then I'm gonna really struggle with managing my own self-care. So I wanna challenge you to reframe self-care, to think about self-care through the lens of what do I need right now to feel okay? And that may be meditating or doing yoga or going for a run, but it might be sitting down and crying, having a real good cry. That may be what you need right now to feel okay. It might be a nap or reading a chapter in a book or watching an episode of your favorite TV show or just staring outside the window and watching the leaves fall off the trees. That reframing and taking ownership over what your own self-care needs are and how to best ensure that you can meet them, I think is really critically important as we move through this. And then lastly, I want to just briefly mention the fact that the seasons are changing. It's getting dark really early in some parts of the country. And the holidays are coming, and the seasonal changes and the holidays, those can be difficult for people in the best of circumstances. But I think during this pandemic, we really want to pay attention to those issues in particular, so that we can start to prepare for what the next 4 or 5 months are going to be like. I know we're all hearing about the numbers going up and everyone worrying about increasing even more when we're starting to spend more time inside. And yes, that makes sense for us to be thinking about how that's going to affect us. But I think it's also important that we're thinking about resiliency and self-care. What can I do to make these holidays as successful and as pleasant and as positive as possible? What can we do as a family? What can I do with the people who I live with, who I'm spending time with, to be able to have some level of normalcy while also recognizing that it could be a really hard year, and thinking about anticipating that you might start to feel even more changes in your mood, even more changes in your level of anxiety as we continue. It allows you the opportunity to start to think about what a plan might look like. So if you're anticipating that things may be more difficult, then you may have more resources or more opportunity to think through what resources you may need in order to get you through those next several months. So I think just in closing, we're seeing a significantly greater need. We have already served through our helpline the same number of people since July that we served all of last year. So people are reaching out, which is an amazing thing. And we're all struggling in some way, shape, or form. And I think that if we can recognize the ways in which this is affecting us, and we also recognize that other people are going through it too, and we can share that compassion with ourselves and other people, and help each other get through this by staying connected, and talking to people about what it is that you're going through, that we can get through these next several months if we're intentional and we try to be deliberate in the strategies that we're developing for ourselves, and we're leaning on each other in recognition of the fact that this is a universal issue, especially at this time. And hopefully we can get through it together.
Awesome. Oh my gosh, thank you so much, Matt, for that and overview and just kind of giving us the general picture of what's happening right now and how to reach out and when to reach out and to reach out to the folks who may be needing us, or if we need our help, where to go. I think one thing that we may want to mention too on the call is a resource you have for organizations and for businesses if people are managing folks or can use that within. I know you have a mental health 101. Is that something you would recommend for people who are wanting to address or give space to talking about some of the issues that people are facing?
Yeah, if you're thinking, so that's the talk the information I shared is really about us so that we can think about ourselves, and hopefully it passes through and we start to use it to think about our family, our friends, our colleagues, our staff. But I think that if we're thinking organizationally, NAMI NYC has a pretty robust workplace mental health initiative. Mental Health 101 is usually the workshop that we recommend companies start with, just because there's so much misinformation about mental health and mental illness. And we want, before we start to build on a foundation, we really want to make sure that foundation is solid. So it's a great place to start for companies that may be newer to these kinds of conversations. But in the same way that I said that we all are dealing with this in unique ways, every company is going to be different too. So your company culture and where you are in the mental health discussion will sort of determine kind of what interventions, what workshops, what programming we bring in. So we try to create opportunities to have bespoke content and a plan that is unique to this company because of where they are and the culture and all of that. So if you're interested in learning more about the Workplace Mental Health Initiative, you can reach out to me. I'm happy to have those conversations and start to explore what it might look like to partner together.
Do you have a few moments for questions from the audience here? If anyone wants to.
Yeah, a few.
Okay.
Yeah.
Does anyone have a question they'd like to ask? You can either wave at me or drop it in the chat and I'll unmute you. Let me just see if anyone is going to ask anything. Just out of curiosity, have you partnered with a lot of organizations? Are you planning to partner with other mental health organizations in the coming year? And with companies?
Other nonprofit mental health organizations?
Nonprofits and companies, or a combination thereof?
We've partnered with a lot of companies. Yeah, we've worked with entertainment companies. We've worked with financial services companies. We've really, I think we're seeing that companies, especially now, are really paying attention to the issue of mental health and well-being for their employees. So we've started to see an increase in different corporate entities reaching out and seeing if we could bring things to them. So law firms and tech and media and finance, as I mentioned.
We have a couple questions that came in about children's mental health. Abigail Lehman wanted to ask if you could speak to the children's mental health and impact of creative outlets. And then we also had a question from Amanda Deb about resources for children. Yeah,
so I think certainly we need to be mindful of the impact that this is having on young people and talk about loss and the inability to really understand the way that adults can, just because of the way that the brain develops. NAMI New York City, actually, we don't serve children, but we serve parents, which I think sort of relates to what I was saying, how I started with the individual being sort of in the middle and the people who care about them surrounding them. So I know that I believe there are resources on NAMI National's website that may be useful for children. At NAMI New York City, we're more about coaching family members, parents, and caregivers how to better support their young person, how to be a better advocate for their young person. But it's less for us about the strategies related to the child's mental well-being. But I can certainly look into other resources and share them with you or with Drew, and we can get them out to the participants.
Yeah, that'd be wonderful, because I know you have to jump off. We have, of course, we have questions flooding in. Someone from New York in school and planning, working in healthcare or occupational therapy. Their name is Jamie, and they are now more than ever, they're needing resources and outreach in mental health. So if there are resources we can point folks to, we can certainly share them after the meeting. But if there's anything you want to mention.
So NAMI NYC, we have, obviously when people call, we offer them all of the services that we provide internally, and they're all available free of charge. But we also have a really robust resource directory that can connect people to any kind of resource, any intersection with mental health, whether it's employment or housing or psychiatry or therapists or other kinds of doctors, regardless of legal services, whatever the issue is, we're able to refer and connect to other resources that exist. So we're a great source of information and referrals for other entities in the city that for both clinical and non-clinical services and support. So if you call our helpline, and I can throw that in the chat, it's 212-684-3264 is our helpline, and we are open Monday through Friday from 10 to 6. And if you want to take a look at our website, which I also threw in the chat, you can learn more about who we are. I didn't really go into the services we provide. You can read all about that on the website. And frankly, you don't even need to know, oh, I want to take this class or I want to be in this group. If you or someone you care about is dealing with a mental health issue, you don't even need to know the questions that you want to ask. Pick up the phone and call, and we can help. We can figure out what your needs are, what your family member or friends' needs are, and how we can best support you as you support them or you support yourself on this often challenging journey.
Awesome. Well, again, thank you so much for your time. I know it's limited and you're very busy, but thank you for your support, your advocacy, and for being with us today.
My pleasure. I'm sorry that I can't stay for the duration, but I hope it's a terrific chat.
Awesome. Well, have a great day, and we'll stay in touch.
Thanks, everybody. Take good care.
Thanks.
Thanks, Matt.
Awesome. Well, thank you for that. And we are now excited. Drew, I think you might be muted, but I'm going to introduce you anyway, but you will have to unmute. So Drew Train, as I mentioned earlier, he is the managing partner of a social impact agency called Oberland, and they have racked up dozens of awards in the social impact space. And they've been doing a series, a research series called There Is No Normal, Only New. And Drew is here to chat about some of the findings from the 6th volume about mental health. Drew is also a board member of NAMI and has been a really big advocate in the mental health space for a number of years. And so Drew, if you'd like to introduce yourself a little bit more and then kind of dive into some of the research that you've been exploring.
Sure. Thanks, Jen. Hello, everybody. Thank you for coming to listen today. Like Jen said, my name is Drew Train. I'm the president and co-founder of Oberland. And we have been working for the last 6 months, 8 months now. It never seems to end, on how we're all adapting to COVID. We've been taking periodic surveys of 1,000 Americans at a time, starting in May and tracking all the way through the end of October, as to how they're responding to what has been kind of a very unique and challenging year for us, and where Matt spoke a lot about what we can do and what we can expect as individuals and what we can do to take care of ourselves and our friends and family. A lot of what we've been focusing on at Oberland is the collective, what we can do as a group, as a society, as a response to what's happened to us. And so, like Jen said, I'm also, in addition to being at Oberland, I'm on the board of NAMI New York City. So I know Matt quite well. And I'm on the advocacy committee there. And so part of what we're charged with is, we're here in New York City. What do we do, and what does it mean to advocate for people with living with mental illness or people experiencing challenges to their mental health now in the landscape we're in. And so what we have today is a little bit of the research that we've done up for the last 6 months, which we've shared in a variety of formats, and some new research on what a response might look like. We're debuting it today, and we hope you like it. I'm probably going to talk for about 15 or 20 minutes and then open it up for questions and discussion. So we'd love some feedback, and feel free to make this as conversational as we can. Sorry. So, if you guys can see the screen share here, this is pretty much what the world feels like for everybody right now, right? The game board, the familiarity that we've all experienced, everything we've taken for granted, whether it was our morning commute and our morning coffee shop, to personal relationships, to the economy, to what the norms of social behavior are, to what is the truth, have all been kind of shaken to their core in one way or another. And regardless of your individual situation, the almost universal feeling is a sense of uncertainty and discomfort one way or another, and to one degree or another. And that's changed a lot of things for a lot of people, and I think it's also created opportunities in a variety of ways, and that's really kind of what I want to focus on today, because I've been advocating for mental health through anti-stigma campaigns for 10 years. According to Facebook, I launched my first mental health campaign, debuted 10 years ago on November 2nd. And I think Matt talked a little bit about the fact that there's still a lot of stigma in the interpersonal, but I think there's been a tremendous normalization of the discussion and the need to respond to people's mental health, to the point where, as a group, we have achieved the gravitational force to get people's attention now. They're willing to accept that it's something that everyone has to deal with. And we have about 30 seconds to ask for what we want before people's attention span fades away. And that's really kind of the overall narrative that I want to talk about today. And I don't think it's any surprise, but when we first launched research in May, one of the first statistics we came up with was this one, which was 83% of Americans that we surveyed self-reported feeling stressed and overwhelmed since COVID began. That survey was taken the first week of April. So this is at the very beginning. People were already nationwide feeling stressed and overwhelmed. We've kept asking this. This number's held pretty steady. I don't think you'll ever get 100 people to admit they're stressed and overwhelmed, but the fact that 83% do, I think, is a tremendous signifier. When we ran a question like this for NAMI New York City in 2011, when we did the I Will Listen campaign, 12% of people were willing to admit feeling stressed and overwhelmed. Now, we weren't in the middle of a pandemic, but I don't think under normal times you'd get a number like 83%. But I think that the collective trauma we've all experienced with COVID has added to that. And we also found interesting that more people self-report seeking help. 65% of people actually reported trying to find help with resources. Interesting to note that white people reported finding help 80% of the time. Black and other people of color reported finding adequate help 45% of the time. I don't think people are entirely shocked by that tremendous disparity in terms of resources and the ability to get access to help that people need. But the racial injustice that exists in all facets of the world, unsurprisingly, exists in the disparity of people to get the support they need, particularly for people of color. And that was a number that held true across the country, but was also true here in New York City. And so that kind of brings us to the next kind of collective conversation that we've all been having this year, which was a conversation about Black Lives Matter, about racial inequality, about the murder of George Floyd and Breonna Taylor, and many other people. And whatever positions people may have on racial inequality, the experience we had this summer with cities and towns across the country getting involved, getting active, being having in the street protests and demonstrations and peaceful celebrations, and also some situations that got out of control, was a collective shock to the system. We have not seen activism on that scale. We have not seen people in the street on that scale in a very, very long time in the United States. I can't recall it in my lifetime at such a broad scale across the country in large towns and small. And I think that has also led to a situation where we recognize that racism is so pervasive and systemic that fundamentally things are going to need to change in ways that will upend a lot of things that a lot of people take for granted. And I think combined with COVID also reshuffling what people have taken for granted, you know, the situation we all experienced this summer and continue to experience and need to continue to work on regarding the racial inequalities in America are also opening the world up for new possibilities and new opportunities, but wide scale change. And that can be positive or negative, depending on where people sit. And then we also have the collective experience that is the rolling election that we've been going through. While you know, people may have different political opinions, we found that nationwide 61% of people report feeling changes to their mental health situation due to the election. 2/3 of that negative, a third of that actually positive. And there was no, it didn't matter, party or politic didn't matter in terms of why people were feeling positive or negative. And nor did their particular candidate's outcome affect it. I think some people, the tone and tenor, they didn't like. Some people on both sides did like the tone and tenor, and that's just kind of where it fell out for folks. But I think collectively, this was another thing that shattered norms and expectations and rattled what we all take for granted. And all of this has led to, you know, the collective experience of more situational stressors and a higher, you know, a higher level of challenges to our mental health, given these situations and the fact that they're continuing. That level of raised anxiety that Matt talked about is going to be around. But what it does is, as far as creating an opportunity, is it aligns the interests of everybody with the interests of the, you know, a couple percent of people who live with chronic mental illness and serious mental illness, and who need fundamental change in the system, need to be heard, need to be respected, and need to have their needs met in more systemic, different, bigger ways than people who are just experiencing, not just experiencing, but that people who are experiencing a situational mental illness or situational depression or something that is likely to dissipate or bounce, or they're likely to recover from when the stressors are removed, if, you know, if we get a vaccine, if life starts to return to normal. And so the responses to help both sets of folks are different, but their interests are aligned, and now is the time, because we have unprecedented support from a variety of institutions in our society. People now have enough experience and exposure to high levels of anxiety and pressure and you know, disruption in their life. Dysregulation was a phrase that Matt used. That as individuals, we now have enough collective experience. I think as organizations, this year has brought unprecedented corporate engagement into the mental health space. You know, Matt didn't have a chance to plug the video that NAMI New York City was a part of, but I certainly will take the opportunity to plug the video that NAMI New York City was a part of with Sarah Jessica Parker, Inside and Outwards, which was supported by a wide range of commercial entities, right? Which you see here on the slide. It's a great reflection on what some of the challenges have been like during COVID. Thank you to Ty who posted the link in the chat function there. It's a 5-minute long video. That link goes to NAMI's webpage. Take a look at it. But the idea that even Matt kind of mentioned it in the Q&A, companies are involved and getting involved at a scale they never have before. And I think that is important in creating the opportunity and the conditions for us to be successful to ask for something outrageously big. And, you know, another coalition, I noticed Pamela Bell is on the phone. So Pamela Bell and Kenneth Cole led a group to form the Mental Health Coalition, which is also supported by a lot of nonprofits. A few of them are shown here. But this is a group that has worked to get, these nonprofits have worked near each other for a long time. There's a lot of relationships between them, but they came together to support the Mental Health Coalition, to engage with a number of corporations as well, to start to challenge the stigma and engage in a more productive, more real, more authentic conversation around mental health, and in a little bit different way than it's been done in the past, a little bit more fashionable, you know, given Kenneth and Pamela's background. But what it shows also is that, again, support coming from all kinds of places. There's new energy in this space that has been on the sidelines in the past, and we're kind of hitting critical mass with support. And, you know, here's another list of brands that all did independent programs, right? Each of these brands here had some sort of mental health initiative internally or with a partner around the country between May and October of this year. And so, you know, we didn't duplicate brands on any of the pages. We tried not to duplicate any of them. But, you know, it didn't take long for us to find 30 or 35 different brands that had activations around mental health this year. And that would have been a hard thing to do in years past. And I've tried. So I think the ground and the conditions are set. And then here's a little bit of the new research that we did. So there was a lot in the response to George Floyd about how police handle crisis, how people living with mental health and their interactions with police often lead to tragedy. And so NAMI on the advocacy committee, we kind of consolidated around a few alternative interventions, which we put out to the public to see who supports what. And we found that at least 65% of people agree with all of these proposals. And these numbers hold true on a national level. In fact, they're even more popular when you go to a national level. But the idea of having a specialized mental health call center, an alternative to 911, this is something that's is being worked on at a federal level, but could be something implemented at a very local levels, to handle inbound calls and to dispatch alternative mental health crisis teams. So teams of professionals that probably don't involve the police, although at what level and in what occasions police involvement is less unanimous. But the majority of folks support not having the police involved at all, and having it be professional mental health crisis responders, people who know how to handle situations, who know how to de-escalate interventions, and who know how to treat people with dignity and humanity to bring situations to better outcomes, non-violent outcomes. in particular. People also supported increased capacity for outpatient care facilities. People supported diversion centers so that the response to a mental health crisis isn't to take someone to a jail or a hospital, but to provide an alternative destination that is better designed and has the right group of resources and staffing um, and funding to address situations, to de-escalate situations, to treat people with dignity, to get them lasting support, and to avoid putting people through the system, whether it's the criminal justice system or kind of a medical system that doesn't always have a lot of great outcomes either. That these centers can be available, that they can be funded, and they can serve as connectors so that people can get kind of sent on their way or in the right way, with connections, with support, with follow-up care. And even 65% of people supported the establishment of mental health courts, which has been piloted here in New York City, and which is an effective alternative intervention, again, to not criminalize illness. And I think that these things are broadly supported. Like I said, we also ran the same set of questions and the same set of policies nationally, and the support grows. And I think that people are ready to recognize that we need very, very different resources and supports. And I think that, again, speaks to the opportunity. Interestingly, I'm going to switch to national numbers now, but sorry, this is supposed to say at least 81%. My mistake. Of all Americans support policies that allow people to live with dignity in their community. Oh, I'm sorry. No, it is 89%, but it's not a sum of the ones on the right. I misunderstood. So this is an independent question. 89% of people support resources that have the goal of letting people with mental illness live independently with dignity in their community. And when we broke that down, we looked at issues like supportive housing. So supportive housing programs designed specifically to meet the needs of people living with mental illness, 86% support. 87% people support policies that provide job training, interview assistance, career development, and other initiatives to support employment needs of people with mental illness. 86% support programs that provide tutors, financial support, and other initiatives to provide to meet the educational needs of people with mental illness. 85% supporting policies that provide free legal aid and financial support designed to meet the legal rights of people with mental illness. And 84% support providing all of the above to people currently incarcerated and on their way out of prison or recently discharged. And I think that empathy for people in prison and people on release is not something that you see a lot of. And the fact that these policies and this kind of support and aid is supported even for people who often receive the least empathy in our society, I think goes to show how ripe the opportunity is. And so, the challenge that I'd like the actual mental health experts here today to discuss. I joke I'm not a mental health expert. I'm mental health expert adjacent. Right? I'm just an advertising person. But really, I think we have the opportunity to ask for substantive, massive, large-scale change that will support people's real needs going forward. At some point, Congress is going to open the piggy bank to provide a hopefully relief bill for COVID, as well as other major initiatives going forward to help rebuild the economy. We need the mental health New Deal, right? What is the massive policy agenda that can unite the community? I think components of it, are broadly supported by the public. and the wallet's going to be open soon. And if we don't have our collective shit together to make a big ask, we're going to miss the window. And so that's really my pitch for today. And I'd love to open it up to questions, comments, thoughts, and a broader discussion for a little while before we get into the formal panel.
Awesome. Thank you so much, Drew. And just for the record, Drew is not asking for money personally. This is this is money to support the cause broadly that we should be thinking about asking for it. And I chatted with Drew before the call today. I remember working on a hunger grant where 9 different organizations applied for a multi-million-dollar award from the USDA. And I think we're facing kind of a similar situation where we're going to have to band together and collectively ask for what's needed. But yeah, I would love if anyone has any questions, feel free to unmute yourself and just ask them here on the call, or drop them in the chat box there.
I have one for you, Mr. Train. What
Is that Mark Fowler?
Brand? Ty here. Ty.
Hi, Ty.
No worries. Hey, how you doing, Jen? Curious what brands you think aren't doing enough right now, and what brand do you think would be the most impactful to kind of take on mental health that is kind of avoided the subject so far, or not kind of been as opened as the companies that you listed above?
I don't think there are companies that I feel like all companies should say something. Everyone has a team, everyone has customers, everyone has employees. I don't want to shame any companies in particular, but I think some of the bigger, more institutional brands in the US could do more to help further the conversation. So I think from a practical perspective, big businesses that employ lots of people like the McDonald's and the restaurant industry, although they're having their own challenges right now, it'd be great to see them provide more resources to their lower end employees, lower end on the income spectrum. And because they're places that have so much retail footprint and they're in so many communities, and food is kind of a natural icebreaker, I think there's an opportunity around the conversations people have while they're eating to start to break down stigmas and maybe create safe spaces and things like that. And I think there's opportunities for brands to, if they're really creative in how they address the situation, use their power differently. So although I think it's hard to ask restaurants for a lot now, but other big institutional brands, the US military could do more in their, I think, recruitment to address mental health. I think also in their, while the DoD isn't exactly responsible for veterans, I think more attention and more support, although it has certainly grown over the years, from those brands to help normalize mental illness to the broader population would help as well.
Awesome. Drew, do you have any future plans with Kenneth Cole or some of the other brands that you've been working with around mental health, or any things that we can work on getting involved with?
We have future ambitions. I don't know if I have specific future plans. I'll, Pamela, I know you're on the line. I don't know if you want to speak to what you and Kenneth have cooking.
Hi, sure. I'm in a little bit of a strange zone.
No worries. Awesome. Does anyone else have any questions? Because I think we're about ready to start our expert panel here shortly.
All right.
I don't see anything coming in, Drew. I think everyone's just taking it all in. No, I don't think so. I think just people are so zoomed out that they're not used to engaging as much. And we just asked, where can we see the research published? Is it on your website?
So no, actually the research, this batch of research hasn't been published. The first 5 versions are available on our blog, which Ty is frantically pulling the link up for now and posting it.
Okay, well, we can
So
share
you can
afterwards.
read about the previous mental health findings that we've had. We did research on how people responded to the Black Lives Matter activism over the summer, how people have changed their eating habits. We did research on how it's changed health technology, how it was related to the election. And then this, I'm trying to work with Matt actually and Pamela and Kenneth Cole to get an op-ed together to publish all of this. So I haven't actually released it anywhere yet, but it's coming soon, and we will certainly be emailing whatever we can get published to the group as soon as we have it.
Awesome. So this is a sneak preview for all of you of what's to come. But thank you so much, Drew. This has been really helpful, and thanks for always kind of supporting the Cause Marketing Summit. And if there's anything, actually one question I did want to ask you, because I know you do so much work kind of internally as an agency. Are there tools or things that you do internally to help remove stigma around mental health and help with just sharing overall and checking in with your staff that perhaps people on the line could understand a little bit more about?
Sure. So Oberland's about 30 employees, and we've had a number of people come and go through the years. So we've actually done NAMI's Mental Health 101 course, as well as NAMI's In Our Own Voice programs, which were really impactful, great experiences. Matt undersold them. They're very helpful, and they do a lot to create a safe place. Also, I'm very open and honest about my participation with NAMI. I bring NAMI up all the time with the team, so they know that it's a place where people can talk about mental health and mental illness. You know, my partner talks openly about, you know, his going to therapy from at various times, and other people in the company talk about it. We actually don't make people report time for going to therapy as time out of the office. So people just, you know, block it on their calendar. But we have a culture where people like know that the world is hard, and you know, it's just not easy for people. So we've been lucky to be that way from the beginning, and I hope that that's one of the great things about working at Oberland. But we've done the NAMI programs. We've also got a great Black Lives Matter and diversity, equity, and inclusion program called Nothing Changes If We Don't, which touches on a lot of other issues that affect people's mental health, but aren't necessarily directly related to mental health and mental illness in their specific nature. But having those programs also goes to create a culture of openness and a culture of it's okay to talk about the real things in the world here.
Sure. You don't have to ignore them.
Yeah, whether it's mental health or politics or bad news or viruses or people getting puppies, like we have a place where people feel comfortable just being themselves and sharing the experience, whatever that may be. And so I think there's no specific silver bullet for mental health, but I think if you can create a culture where people feel comfortable not being judged for who they are, it'll enable the space to deal with mental health issues when they come up.
Absolutely. Mark Fallows just raised his hand. Mark, did you want to ask a question? You can feel free to unmute.
Yeah, sure. Can you hear me? I'm in a co-working space. It's a little bit noisy.
Yeah,
so
I can hear you.
You can. Okay. Yeah, great presentation, Drew. I just had a question as you were talking there. Do you think we'll ever get to a stage where organizations, enlightened organizations, start to consider mental health as an investment in human capital, as an opportunity to gain competitive advantage over other organizations, particularly as AI takes over many more standardized roles, and we need to enhance the creativity of staff to get the best out of the workforce and humanity. Are you seeing any evidence of more enlightened boards or individuals and organizations that might be sort of reframing the way we think about mental health and to be more sort of mental fitness or creative optimization of workforce?
That's a great question. I have seen over the last 10 years significant change and move towards that position, but only recently from the kind of higher level, bigger institutions. So I can recall being at an event in 2016, I think it was the CEO Mental Health Summit, where the CEO from AIG came in and spoke. And he, talked about research that they had found that, and this was just an anecdote that he used that kind of changed his perception, but he found that through their procedures, shoulder surgeries were the procedure that were most likely to lead people to opioid addictions. And they basically told their doctors to stop prescribing opioids after shoulder surgeries and prescribe Tylenol and tell people to deal with the pain. And that little anecdote led him to understand the power of looking at big data and how he could use that to change his organization and the organizations that AIG works with. So he wound up building a team of like 200 mental health professionals that were, going to endeavor to change their whole apparatus. Unfortunately, I don't get a lot of time with him, so I wasn't able to follow up and see how that experience went. But that was something that struck me, and I think that as you start to see, I also remember in some of those workshops at the Mental Health Summit, the people, brands like Goldman Sachs and American Express and Prudential and PwC and some of the bigger kind of institutional type companies starting to try to have conversations with their leadership that this was an investment, not a cost, and that this would improve productivity. And at the time, the argument centered around the concept of presenteeism, right? People who are there, but just going through the motions. And if we can just get 10% better optimization out of that employee because we can fix the presenteeism problem, then we're going to unlock all this human capital in our company. And I think that argument persisted for a while and was starting to penetrate. But I think we're at a place now where we've almost kind of jumped over that argument, and people are like, there's a more human argument that people are responding to, which is that it's an undeniable now that people need more mental health support than they've ever needed before, that we lack the infrastructure and capacity to do this in any kind of serious way, and that we need to build it. I think people are there. Nobody knows or has written down in any kind of way where you could wave it around like AOC does with the Green New Deal. This is what we need to do. And I think if we got there, you'd see big companies, you'd see small businesses, and you'd see a whole lot of people supporting it without really a lot of fuss over the detail. I think it's just kind of an obvious thing. We obviously need to deal with this now.
Mm-hmm.
Yeah, it just seems to be so foundational to unlocking the potential of people in organizations, particularly as we try and encourage more diversity of thought in organizations to unlock innovation. You'd think it would be absolutely core for organizations to see the value in making people's individual self-worth increase and deal with any issues that are unseen. And we're just obviously familiar with people like Wendy and the show Billions. And if that could start to become a standardized policy across organizations, it could unlock huge growth potential across businesses and just reimagine the way that businesses operates.
It could. I think also we're at a place where we lack some of people don't know how to make it practical. Right? Like, what does it mean for a business to practically invest in people's mental health in a way that's going to yield those returns, for a small business like mine with 30 people or a big business with 30,000 people? the workplace mental health programming and resources and support industry is a little bit behind, I think.
And too, Drew, when you say there's certainly, obviously not more stigma, but people are more apprehensive to share something in a workplace setting versus in a personal setting. It's not a lot of, I don't think broadly people are comfortable with, with talking about that in a work environment. I speak for myself, but I imagine that must be a hurdle.
Yeah, I mean, we found that when we did research, it was 2012, so it's a little bit old, but when we did research for NAMI, when we created the I Will Listen campaign, we found that 45% of people would recommend to a friend that if they had a mental illness or a problem with their mental health, that they should talk to a family member or friend about it.
Mm-hmm.
Only 8% of people recommended that they talk to their employer about it. Right. So that goes to show you that I think the gap in where people are comfortable talking about it. And while I bet that gap has closed over time as business culture has become more accepting and more understanding, the gap, I'm sure, is still a gap. It's not parity.
Definitely. Well, awesome. Thank you so much. I want to be mindful of time because I know we're kind of going over a little bit, but if anyone has a last question for Drew, please chime in now, and then we'll get started with this expert panel we have coming up. I'm so excited for. And if there's anything else, Drew, you'd like to share in closing, please feel free.
No, I'd just like to, thank you, Jen, for pulling everybody together, and thank you, folks, for listening. And I'm excited to hear what the panel has to say.
Okay, great. All right. So I think we definitely have Dr. Tara. Thank you for being here this whole time. She's let me just make you a co-host so that you're able to unmute and share with us, which I think you can do. And then Catherine Ponte, I see you over there. So I'm going to make you a co-host as well. So feel free to unmute yourself as well. I think we may be missing Karen Glover. I was trying to check on her on email, but she may be. Karen, if you are on the call, please unmute and chat with us if you can. In the meantime, I'm going to introduce two of our expert panelists here. So I'll start with Dr. Tara Amrani. She is an experienced clinical psychologist with a demonstrated history in working in the hospital and healthcare settings in both outpatient and in the private practice. She's focused on clinical psychology with an emphasis on neuroscience and women's health. Dr. Tara, if you'd like, I'd love if you could just introduce yourself to us, tell us a little bit about your practice and what it is you do.
Of course. So hi, everyone, and thanks for having me on. I really enjoyed all the presentation, and it was very nice meeting everyone and learning so much. So as Jen mentioned, my name is Tara Amrani. I'm a clinical psychologist practicing in downtown Manhattan in my own private practice, currently virtually only because of all the stuff that we just talked about. I've been practicing in my own firm for the past 4 years, and mainly seeing clients between the age ranges of young adults, 18 up to older adults, 50, 60, 65 and up, and kind of presenting with various difficulties from anxiety disorders, depressive disorders, trauma, and life challenges, but also a lot of like ongoing New York City lifestyles, whereas kind of having to manage life and work and everything else together, and before the pandemic, and how hard it was, and currently kind of seeing a lot of the cases where it's everything that was going on top of it, a pandemic and a political climate that has been very difficult for most people, if not all, and more. So that's a little bit about me, Jen. I'm not sure what more would you like me to share before we jump in.
Sure. I guess just a little bit about, have you seen an increase in demand for your services or people reaching out? Have you seen a big difference between, last year and, this year, kind of starting in March and when the pandemic broke and everything else with Black Lives Matter and the election? Have you seen a marked difference in your practice and in how you're working or who you're working with?
Of course, that's a great question, actually, and very relevant to what Drew was talking about, I believe. To be honest, actually, my practice have seen similar amount of kind of coming in and going out, but what I've seen mostly is job losses that has caused people not be able to afford to come in for private practice clientele, like my private practice. My practice, unfortunately, does not accept any insurance, so I'm kind of considered out of network. And some insurances do kind of reimburse for the out of network, and some don't. And a lot of those people who've lost jobs during this pandemic, they were relying on the out of network for their kind of therapy hours, kind of lost that luxury, and during the time that they needed it the most. And so there are ways as a private practice that you can work around it and make it work for your clientele, but also as a company too, you kind of have a way that the business development goes. And being at the hospital in the past and working at nonprofit places, I could see the differences between like community service and my private practice. And I think a lot of people who've unfortunately lost their kind of jobs, or they had to be let go, or they lost the kind of the privileges of being able to kind of seek for therapy, which upsets me and hurts my practice as well, on the other hand. On another hand, on positive note, a lot of people were able, fortunately, to recognize that there's some mental health needs that needs to be paid attention to. And so the increase from that side was that people needed to really kind of learn how to cope with anxiety and the stress of everything that was happening. So doors opened up more in validation around seeking help and being able to say, oh, I need help because this happened and that happened, rather than, oh, I'm having some difficulty in the past before the pandemic. So I think you see a lot of hits and misses there.
That's great. Sort of what Drew was speaking about, the stigma has been removed. And I think because we are collectively going through, what's been described as trauma, everyone feels a little bit more comfortable saying that they're not okay, because who would be? So it's kind of, expected. But thank you for sharing. And I'm going to move to, hold on one moment. I'm going to highlight Catherine here.
And before, Jen, I lose you, you go to the next thing. I just wanted to highlight what Matt Kudish also said about the fact that during these times, also because it's a traumatic event, I think people come together, and I think the support of others helps people to kind of like be motivated to, even if they can't reach out to kind of a therapist yet, but to hear about other people's experiences and feel validated and have more strength and kind of a push to go towards that approach.
Mm-hmm. More of a community surrounding them to help. Awesome. Well, I'm going to move to our next expert panelist, Catherine Ponte. She is the founder of For Like Minds, which is an online mental illness peer support community. And she's a NAMI board member and a monthly contributor, an active collaborator with Yale University, the Psychiatry School of Medicine. And she's authored one of the only studies on mental health impacts of COVID on those already living with mental illness. So Catherine, I'd love if you could just introduce yourself. I think we need to unmute you, or I can ask to unmute you, or if you could unmute and just kind of introduce yourself to everyone and tell us a little bit about you and your experience and how that your experience has changed as a result of this past year.
Firstly, I'd like to thank you for this opportunity. And more importantly, I'd like to thank everyone here for their interest in mental health, because we need more of it, and it shouldn't take a COVID to try to help the 1 in 5 people that live with mental illness in our society. So a bit of what was also already mentioned, I'm a mental health advocate. I sit on the NAMI board. I'm a writer. I just came out with a book recently about my lived experience. I write monthly for the NAMI national blog. I'm an entrepreneur. I have an online platform, mental illness peer support community. I also coach parents with children with mental illness. I have a program that visits psych ward patients. I'm also a lawyer, and I actively collaborate with the Department of Psychiatry at Yale University. And most related perhaps, to all of this, I've been living with severe bipolar 1 disorder with psychoses for 20 years. I've had personal experiences with the criminal justice system, and I've also had 3 encounters with the police for mental health in a mental health crisis response. So I have personal experience with many of these issues, and my passion is the serious mental illness community, which I think often gets overlooked. Our society tends to focus on the 2 most prevalent mental health conditions, which is anxiety and depression, which is what many people going through COVID is experiencing right now. But there has been very little discussion about what the serious mental illness community has been experiencing. And serious mental illness is bipolar, schizophrenia, and major depression. And these people, we already have a heightened vulnerability to stressors. And stressors can make our conditions worse, our symptoms worse. And what's interesting is that, we've been living with loneliness for a very long time. And nobody really seemed to be paying attention to that before. Although the adverse consequences of loneliness, including reduced life expectancy, has been well known for many, many years, and studies have shown that. And so I am working together with Yale University, studied my community, which is around 40,000, 50,000 people now, people living with mental illness and their supporters. We found significant increases in people feeling lonelier and people feeling less socially connected. And those numbers are about 60% for each. And what's important to recognize with those numbers is that people with mental health, serious mental health conditions already experience loneliness. They already experience reduced social networks. So any further reduction in social networks has a tremendous impact on people living with serious mental illness. And there is a great interest now, as we've heard Drew discussed and before, in mental health crisis response. And we've been experiencing these troubles for a long time. When I experienced my own personal encounters, my husband had to call 911 3 times on me because I was in a severe manic state. And the response was police. And a lot of people, the people that get most injured by these police encounters are people living with serious with psychoses. You're in a delusional state, experiencing hallucinations. You're already fearful of what's going on. You've lost touch with reality. And so to have responders that don't understand these experiences can lead to deadly consequences, as we have seen, and very rapid escalation of a situation, which is very tragic for some people and doesn't help at all in addressing what we're experiencing. And criminal justice is very important. There are more people in jails with mental illness than hospitals. Some people don't realize that. While they're in jail, they don't receive the proper mental health treatment. And so what you find is when you come out of jail, there's a high recidivism rate. Many of these people are going to be rearrested for crimes because they haven't been properly treated for their conditions. And without supportive policies, programs in place to help them, like housing, like education, like employment, a lot of these people end up back in jail. And, these issues have existed for a while. And, I'm happy to see more attention coming to them, but it has to be long lasting. It has to go beyond COVID, because, the mental health community is like, oh, this is just something, this attention is just due to COVID. And we wonder, is it going to be long lasting? Is this attention going to continue after COVID. And that's what we need, because when you're living with chronic mental health conditions, you're living with these conditions for decades. There is no cure for serious mental illness. And so we have to continue to address these issues, continue the pressure that has been currently been placed on mental health, the greater awareness that we have right now. And I really hope that we'll be able to do something now during COVID, and that it will have long-lasting impacts in our community.
Absolutely. And thank you so much for sharing. And it was super helpful to gain your perspective and your experience. Has your work changed? I know you've been an advocate for so many years and had so many lived experiences. Has COVID changed how you've been working or shifted your focus of the work you've done? As you've seen maybe some more attention on the cause? Has anything kind of come up for you that feels and seems different?
I'm a very strong advocate for mental health. So this is not for me a COVID issue. It's an issue that's long standing. And so some of the issues that have arisen during COVID have been known before. And so I've continued my advocacy work, and with the hope, I'm not stopping it, I'm continuing it. If anything, I'm hoping to leverage some of this increased attention on mental health to call more awareness to our issues. I've written about COVID, 3 different articles for the NAMI blog on specific COVID-related issues, on coping, on treatment, on resilience. And I've also collaborated with Yale on 2 studies on coronavirus. And so I'm definitely looking at, because I think we need to look at the serious mental illness community as well. And to me, it's very frustrating to see so much discussion right now about mental health issues. But, where was this discussion before? I've been living with serious mental illness for 20 years. I've never seen so much discussion about mental health. And I think it's a great thing, but, I wanted to see something really done this time. I want to see something long lasting. I want to see something meaningful. I want to see something that includes everybody experiencing mental health issues, not just the general public, but those that face mental health issues for, decades. Because what history has shown is that many people are more resilient than they think, much more resilient. During 9/11, there was very great concern about all the mental health impacts on people that were had direct experience with 9/11, those who have lost loved ones, those that were injured, first responders. And what studies have shown is that those people were incredibly resilient, and they were able to come back and to deal with their mental health issues, and some even without any treatment. In fact, they were able to overcome those issues once we returned to a normalcy, had recovered after a period of time. And so a lot of people out there are very resilient, and we're going to discover this once we come out with a vaccine, once the alarm of the current surges that we're experiencing in COVID have been reduced. And so people are very resilient. And it's often the people with serious mental illness that they're going to continue to have these illnesses. And that's where I really want more people to focus on. I think general mental health is very important. Mental health in the workplace is extremely important. And I think some issues have arisen from work from home. How do we deal with the mental health issues of that situation? And I think it's really important. I think the greatest selling point to companies is the loss in productivity. A lot of people talk about how it's going to enable, they focus on the growth, but it's really a loss of productivity, which is in the billions of dollars have been shown due to mental health concerns in the workplace.
I see that, and thank you. That's so true. It's something that we should have been more focused on, and that more people should rally around. And now that it's more of a shared experience, we're seeing more attention. But obviously, we need to see attention, overall, and focus on the people who are suffering the most. Dr. Tara, I have a question for you. I'm just going to add you kind of to the spotlight here, so we're in more of a panel setup. From your perspective, what are some of the things, and Catherine, I'll ask this to you as well, so you can think about it. What are some of the things we should, as peers, as colleagues, as friends, you know, even kind of distant friends on social media, what are some of the things that we should look out for, maybe within our own communities, that we should make sure to reach out to the folks who may be suffering, if we're concerned? Does that make sense to you?
Yeah, totally. Before I even answer your question, I just wanted to say it's such an honor to be in the presence of Catherine. Very nice. It was very lovely to hear you talk about that. And it is something that it needs to be talked about a lot more. And I personally would love to learn more and kind of be part of the advocacy for that, as I don't see it as often as I used to in the past, but it is something extremely important. And especially, as you said, during these times, it's pretty common and it gets sidetracked. It's not something that people acknowledge as much, but it's happening and it's the reality of our lives. So Jennifer, to answer your question, noticing things in ourselves, in our peers, and during these times about kind of what people may be struggling with, I think one of the few ways kind of I would go about this is, you know, these times are really hard because of COVID. We've been kind of subjected to stay at home a lot more, to not be as social, and to not be able to go outside. And if we already have underlying kind of depression or anxiety or avoidance in us, I think during these times it comes up a lot more, but it's seen less. In the past, because of the kind of the need that you needed to go out for a work event or a family event or something like that, you kind of had to do the opposite action. Even if you didn't want to get out of bed, it pushed you to go out a little bit more. But now, because they don't exist, it gets harder for people to do that. So some of the things that I think may be apparent in some of the colleagues, friends, peers is isolation. I think a lot of the times, if you see a lot of people that weren't as muted, they're kind of more muted, they're kind of less in touch, they're not as active, and kind of you kind of reach out to them and they're not as responsive. I think you know, we cannot be kind of assuming a lot, because we don't know, maybe they're just busy. But I think it's best that if there is someone that you're worried for, or someone that you may kind of I think like, oh, maybe they're not having the best time, to reach out to them and just kind of very nicely ask them how they are doing. Sometimes that's small of a talk, like, hey, I'm here with you. And I think Matt actually mentioned that as well in kind of his as a kind of talk. He mentioned how important it is to just reach out and to say, hey, I'm here, I know what you're going through. Just kind of that support system, that validation, that kind of taking that judgment aside. Hey, I'm having a hard time too. And even if you're experiencing, I know mom to mom, a lot of moms are experiencing hardship with younger kids, older kids. Right now in New York, public schools are all closed. So I'm sure there's another surge of like working parents or stay-at-home moms dealing with so many other issues that they thought like, hey, they had it under control. So just kind of reaching out and being there and putting ourselves in each other's shoes to kind of empathize, really. And I think that would be the big starter in understanding what everyone else is going through.
Absolutely. Thank you. Catherine, did you want to add anything
Sure.
from your perspective, you know, what to look out for and how to reach out and what's the best approach as a peer?
Sure. Definitely agree with all of Tara's comments. I think, you know, isolation is a big problem for people with mental illness. There's the isolation of not being in contact with people one-on-one, but sometimes the most difficult isolation to deal with is emotional isolation, being alone with your thoughts. And that's sometimes the most difficult thing to deal with. And you have to, you know, we need more coping strategies, how to deal with uncertainty, how to reduce your news consumption, how to accept the situation as it is, how to have positive thoughts, there's a DBT approach called distress tolerance. And so there are some approaches out there that you can help with dealing with your thoughts, because distraction is very important. Positive programming is very important. Humor has been shown to be a very effective coping strategy if you can find humor in some of the situations that you're going through. So there are strategies out there that can help people with the rumination they will have if they don't otherwise engage themselves. And one of the most helpful things for me is helping others. And it doesn't have to be a relative. It could be an old person, an elderly person who can't leave their house because they're at higher risk. It could be bringing food to an elderly person. It could be helping people with immunodeficiencies, but are also at higher risk of contracting COVID. And there is a well-known principle called helper's high. And in fact, people often who are giving the help receive more from giving them the help than actually the person receiving the help. And so it can be tremendously, a powerful thing. I think we need to have a collective spirit right now because we share many of the same experiences, and we have to act collectively because that is how our voice is most heard in the midst of all that's going on. And we really need the collective spirit that we can overcome this together and address our common issues, because all of these issues that I may be experiencing individually, other people are experiencing as well. And talking more about these issues helps normalize the situation and helps you realize that you're not the only one. Because if you don't speak to other people, you'll start to think, I'm the only one, I must be overreacting, this, I shouldn't be reacting this way. And when you speak to other people, you realize that you're not the only one. But I think our society has to come together to overcome this, because we have seen rapid rates of infection that can be triggered by one person contracting the virus. And so to really address this most effectively, we have to come together to address these issues. We have to step outside our homes and our families and reach out to those closest to you, but reach out beyond as well to have the greatest impact possible.
Mm-hmm. Absolutely. One of the things that has come up a lot is obviously the social isolation and loneliness and lack of touch that has really, affected people before and especially right now. Dr. Tara and Catherine too, do you think that where's the tipping point? If you have a friend or a loved one, do you kind of, I guess there's no real guidelines around, okay, well, do we quarantine for 2 weeks and then we can spend, some time together and feel better? I mean, I feel like there should be some sort of guide to, when mental health is declining so much, when do you say when, and say it's time to have a hug from your best friend? I mean, I think that that's just a question that's no one's really asking. And, to just from personal experience, I have folks who say, well, I think, it would affect my parents' mental health more if I didn't come home for Thanksgiving, more than the virus would. And I think that, obviously that's a judgment call within everyone's home and social circle. But do you have any sort of guidance around that, or what you're recommending to folks who are really feeling like they're at the breaking point or past it,
I think that's a very great question, Jennifer, where I think most people are struggling with, especially these days close to Thanksgiving and with the surges. I think there's a very kind of a thin line between how safe you want to be in terms of like not making your parents sick or grandparents sick, and also how kind of everyone's feeling in terms of like their mental health and how's that impacting them. I think it is a very subjective response. I think everyone kind of with their own kind of backgrounds and kind of where they're at medically, they have to make different decisions. But my suggestion to my clients that have been struggling with this this is utilizing obviously the testings if they can be tested and be very safe for the past 2 weeks that they really want to see their loved ones, and when they're together just stay together for however long they can so they can really get that in, and then like kind of go back to their kind of wherever they were and quarantine and be safe. One of the main things that I stand by is even if the personal touch can't be, even if there's a risk and worry around, okay, if I go there, creating an environment now with Zoom and FaceTime and all those stuff that you can be part of this together, at least get that. It's not the same as physical touch. It's not the same as physical holding each other and stuff like that, but at least you feel included. At least you're not alone by yourself. And it's, as Catherine mentioned, very powerful thing is staying with your own thoughts and the kind of living with that and kind of like being by yourself with those and not being exposed can be really hard. So making sure that your environment that you're at is kind of accepting, is warm, and it can be with other people. So to get you out of loneliness, because the other thing I think that most people at times face is they can be in the house with like 10 other people too, and they still can feel alone. Right. Sure. So it's like really matter of what gets them to feel validated and loved and held. And unfortunately, if times call it for that not being in person, there are ways that you can do it now with technological advancement that is not the same still. I want to acknowledge that, but it can be better than not having it at all.
Right. I've said that about New York City. It can be one of the, the most populated city, but the most lonely city sometimes, because you're like, there are all these people around and they have things to go and people to see. And I'm just kind of mixed in this sea of where do I fit in? And so I can definitely understand, even though being surrounded by folks, you can feel very lonely. Catherine, do you have any kind of words of wisdom to share for folks who might be struggling?
I agree with everything that Tara said again. And specific to mental health, you talk about a tipping point. I think we have to act preventatively. Too many times we act reactively once we see it's hitting that tipping point. And we have to understand that something, we can only help to a certain point. We can only support someone to a certain point. And sometimes they reach a tipping point where they need professional help to deal with what they're experiencing, because a lot of people feel like they feel guilt that they can't help their loved one more than they would like to. And your condition can deteriorate. One good place to start to see if you need extra help and a loved one can take this for you is to do a mental health screening. Mental Health America offers mental health screenings on their website. And you can see the difference, between, do I really need to see professional help, or is this someone that I can just see, get support with? And the government, to their credit, they have really opened up the opportunities to see healthcare providers. One big change was in Medicaid. Now you can see a provider that is outside of your own state, whereas before you had to see one in your own state. And so they have been, there has been reportings that the increase in medical consultations have increased during COVID because of the relaxation of those rules. And so I think that people have to recognize, loved ones have to recognize there's only so far they can go. And people have to recognize if they're experiencing emotional distress, that they have to not be afraid to reach out and ask for help and seek the professional help, because sometimes it's a little more stigmatizing to reach out to a professional, because then that suggests that you have a problem, whereas it's sometimes easier to reach out to someone in your personal support network. But professionals are there to help people who can't manage this on their own, and sometimes people do need that extra professional help to get them through this.
Sure. And sometimes, I speak from experience, people need help, finding the right professionals to access. It could be something like helping someone make an appointment, helping them find a therapist or find resources if, things are in a dire state where you're having trouble accessing those things on your own. Thank you. I think I would love if anyone would like to, chime in and ask Dr. Tara and Catherine any questions from you there on the line. I know for me, this has really been a wonderful conversation. I would like to just ask if there's anything, we've talked about all the kind of doom and gloom of 2020. Is there a silver lining, or are there any things that you're excited about or developments you're excited to see in this space?
I have to really emphasize there is something called tragic optimism, where people can still be optimistic during a tragedy. People think that you can't, they're inconsistent. And there's another thing called post-traumatic growth. The experiences that we are going through right now will really help us develop, greater insight into what is the meaning of life for us. Were we happy with the jobs that we had before COVID? Were we happy spending so much time away from our family? Were we happy with our relationships? Your relationships get deeper. You can develop a deeper spiritual meaning in your life. And so there's a lot of good that can come from tragedy, unfortunately, and people can really grow as people and individuals in their lives so that you can have a better life after right now. It's not all about the negative. There are silver linings, and we have to look to those, because it's those silver linings that give us hope. Mm-hmm. And it's really, we need hope to get through this. And we have to look at not just the negative, but the positive. That's really, really important. And people often don't.
Mm-hmm. Of course. I'm nodding, Catherine. That was on point. I couldn't agree more with you. And I think this allowed us, as unfortunate and as tragic this has been, I think allowed us to kind of wake up a little bit. I think humans tend to take things for granted and just kind of go, kind of like a kind of a
autopilot.
Exactly. Yeah. And I think this allowed everyone to kind of be like, hold on, like, what were you doing? As Catherine said, how's life? Like, do you even like your job? Or how's the relationship? How are you dealing with life? And just kind of the fact that you can't see family members, you can't travel, you having all these walls in front of you, especially in kind of places where you're privileged to have so many advantages, you question like not taking those and not appreciating those and being so focused in certain things that were not that kind of important. And so I think as hope is one of them, appreciation, you found meanings for things, just as small as just being able to walk outside with kind of no mask, or go to a restaurant, or see friends. And so a lot of all these positive things can come from this very unfortunate, tragic times. And I think it can be really taught to the new generation, to our kids, to kind of see the world in a different way, because now they're very close to it and they'll see that.
Mm-hmm. Absolutely. Kind of getting back to basics. I was chatting with friends of mine and saying how in some ways it has been refreshing and positive to take everything away, take all the people, take all the voices, take all the stuff away, and then kind of level and think about, who needs to come back in and who is adding to my life versus taking away. I think everyone's kind of taking inventory of like, what do I want to bring more of in my life, and what do I want to take away, and whatnot. So does anyone else have any questions for our panelists? I know, Drew, if you're still on, I'd love to hear from you if you have anything to say or ask. I didn't mean to put you on the spot now. He's really...
I'm curious, both of you, what kinds of systemic solutions do you think we need right now?
What would you want to see kind of broadly change or be available that wasn't before, maybe?
Yeah, or examples. Catherine, you and I know each other, so I know you know of examples of effective programs in a variety of areas. Can you give some air to some of those?
I think sometimes when we look to expanding those programs, it's a little even premature. I want to see this awareness solidified. I want to see everyone knowing, these issues and knowing what needs, having an idea of what needs to be done. I want to see people come together and advocate for the mental health community and really get that power built up, because once you have a coalition of a large group of people, then you can start really addressing. And as Drew said, there are evidence-based practices out there, but do we have the willpower to expand them, to invest more in them? There is supported housing, supported education, supported employment. People with serious mental illness have an unemployment rate of 85%. 85%. To me, that's unconscionable. To me, it just keeps people sicker and hopeless and helpless. And we need greater awareness of these numbers, because our society at large doesn't really impact how bad it is for so many people living with mental illness. And then I think once we have solidified that awareness, being able to convince people this is an issue, then maybe we can get that funding. Maybe we can get that support. Maybe we can get the political representation that we need to build these policies that exist already. These policies are evidence-based. They're out there. They're just not available to people. And that to me is just, that's not right. And I'd like to see them become more available. And I think before that might happen, we need more awareness. And we have to build on the awareness that has been growing during COVID and continue that.
Absolutely. Would you say, Drew, I know you did a presentation about healthcare and tech, and maybe Dr. Tara, this. Has there been an increase to access to care as a result of the virtual piece coming to the forefront? I know that some people, practitioners probably some were open to virtual, some were not in the past. I imagine that now access to professionals has become more available, or am I wrong?
No, I think access is now better. To be honest, I don't know any scientific research right now on it, objectively, but I think from my experience, I do see access to virtual kind of connection to therapy has changed. And also there's platforms like Talkspace and that makes it easier for people to reach out. However, with that, there's some downsides too, because I don't know how well trained or how well informed or how these relationship could be like, because there's a point where you have a therapist that is kind of has a background and experience and knowledge, and you can see them and you can learn from them, but also there's a point where you rely too much on it because it's so kind of on your phone or text message. There's so many kind of different backgrounds around that could break some things around how ethical or right it is. The other thing that comes to my mind is, unfortunately, I'm sure Catherine might be aware of this too, with the kind of our country state-wise, although there's access, I can see someone, for example, I can see someone from California, New York, but I need to be licensed in certain states. So those limitations on state licensure has limited it for a lot of therapists to be able to continue with certain clients of them. So for example, if my patients was in New York and now they went to Connecticut, I'm ethically not bound to see them if they reside in Connecticut. I need to have a license in Connecticut. So I think those little things, nuances, as much as it's still the same sort of, but it still makes it hard for people to continue with their clienteles or to manage around it and have to be licensed federally or state-wise or all that little stuff that comes with it. So there's pros and cons that I think we're going to grow to learn more about it.
So the therapists that accept Medicare are not subject to these restrictions that you've mentioned. It's psychologists, it's psychiatrists that are practicing do not accept Medicare. So Medicaid has definitely lifted those restrictions. And when you speak of the country as a whole, the regions that have really benefited a great deal are rural areas, because there are many counties that have no practicing psychiatrist in America. And so to be able to have telemental health sessions has really expanded to those people living in rural communities. And there have been studies that have shown that online telemental health is as effective as in-person, but we need to judge the quality of the mental health services being provided, because there is a different, they differ greatly. You know, there isn't a whole lot of support that says therapy by text messaging is as effective as in-person therapy, or, you know, I mean, we have to look at the quality of the therapy being offered as well, because that can make a difference into how effective it is, and your decision as to whether or not, you know, what to go with.
Yeah, and who treatments for? When we did research on this, we found that people who had the more situational stressors found that their access to things was greater, and that's things like Talkspace and the telehealth and those sorts of things. But that the people, when we surveyed a population of people who had experience with police and mental health crises, that group still reported barriers to access. And I think it's not surprising, right? The market treats the people who have where there's scale, right? And in response to this, you know, we had a panel with the Talkspace chief medical officer. They more than doubled their capacity. Just, you know, they just got to work and they expanded rapidly, but their platform is well suited for people with anxiety or depression or the kind of situational things, but not as well suited for long-term treatment of somebody with schizophrenia or
There's mental
illness
illness
that just requires a different level of care. And so it's gotten better. It's also, you know, I mentioned the racial disparity too. Like, it's gotten better for people like me. Access has gotten better for me. But, you know, access to a lot of things is easy for people like me. For people who don't have the advantages that I have, it's not as easy and it's not as accessible.
I mean, Drew mentions a very good point. We often focus on mental health issues, but what causes them? It's the social determinants of health. It's poverty. It's lack of hospitals in a neighborhood. It's
illness,
broken
job
families, relationships. It's employment situations. And so we have to go deeper, dig deeper. It's not, you know, it's just not about addressing a mental health situation. It's about addressing the, you know, racial disparities in our society. It's about addressing why is it that African Americans and Hispanic Americans are maybe twice as likely to live in poverty than Caucasians. We have to look at those issues. We have to go deeper than just the mental health issues to look to see what's causing them, because often we take a superficial approach to addressing some of the mental health issues that exist. And that doesn't result in long-term mental health benefits, you know, not for the person experiencing them and not for their children, not for the futures of those communities. And we have to work to address it now and to address the future, so we can try to prevent some of these mental health concerns that exist right now from occurring in younger generations.
Absolutely. Oh my gosh. Well, thank you guys so much. I know we're kind of coming up at the end of this, but I'm so thrilled to have you and to have your time and to have you share. And if we're all okay with it, I can make this video available after the fact to folks who weren't able to join. I think there's some really important stuff shared today, and some really important people we need to engage further in the conversation and in the action. So I'll pledge to do that, Drew, and you'll kind of keep me honest, as well as everyone on this call, as far as the cause marketing community goes. We've always highlighted mental health in most of our conferences, and it's certainly a cause that's near and dear to me personally. So I really appreciate everyone who's working on this, both, you know, personally in the advocacy world, and agency world. I think it's going to take, you know, everyone working together to continue to move the needle, hopefully in the right direction, and increase the availability and access to care for everyone.
Great.
And address obviously the systemic issues that that Catherine has pointed out as well, that that really contribute to everyone's health and wellness. But thank you so much. It was a pleasure to meet everyone. Feel free to reach out to me if you have any questions, if you need help with cause marketing related items. Thank you to Oberlin. Thank you to Drew for making this possible, and for your support, and for everyone who stick around on the call. So thank you, and have a good rest of your afternoon.
Have a good one.
All right, take care.